Hi, this is Dr. Phil Gatcha with the Functional Health Institute of Atlanta, and I'm bringing you some data today that is constantly being bantered about, and we are getting question after question relating to diet. Now remember, in our office, the dietary issues that we help people handle are based on their testing. If you really want to know what's going on, testing is the way to figure it out. But the general nature of these questions, we wanted to put out some good data on a really controversial topic. It relates to meat. We're going to get into today the good, the bad, the ugly of it, and why it's not as bad as you think, and why some, not overdoing it, can make a big difference. What I'd like you to do is to join our newsletter in the link below this video, and in that way you'll be able to get a copy of the notes that I've just created for our patients relating to meats. We're going to release them on all the different food groups. This is the way to select the most appropriate types of that food, where to get it sustainably, ethically, and environmentally in sound ways, but also get it in ways that it's most healthful for your body. So let's begin. Sickness is a result. Sickness is a result, and so is health. It's based on your choices. And so over the years, we found that in 20 years of practice, we know that 7 out of 10 deaths, 7 out of 10, 70% of all deaths right now in the US are related to chronic disease. Chronic disease being defined as a disease you have control over, something you can do something about. And most of those cases, the disease that's happening in a given person's body is related to the food that they're eating. We know that the food industry makes profits from the things they do to our food, like additives, like preservatives, like getting the cost of food down. So they get the profits, but the problems that arise from what's in that food that doesn't agree with our body, that causes disease, those costs, well, that's given to the taxpayer. So they get the profits, we pay the cost in our terms of our health and also in terms of finances. So in these 20 years of helping people regain their health, revitalize their bodies, testing to figure out how to give them a sensible approach to optimizing their health, we've done things in terms of helping people find better food choices, what supplementation is appropriate for them, helping reduce stress, strategies for proper movement, proper sleep, helping to make sure their mindset, their relationships, that they're doing things that are giving them the best quality of life possible. We've seen amazing change, but I can tell you with utter certainty that unless you make a change to how you're eating and you're fueling your body in the most appropriate way possible, you're not going to get well. In other words, you can't outperform a bad diet. With that being said, if you want to take back your health, start with your food. So meat, controversial topic. In the 1950s, a researcher named Ansel Keys released some cherry-picked data. Confirmation bias is what they call it in research, but he released some data where he was looking to find that something called saturated fats were a culprit for heart disease, for cancer, cardiovascular problems. And based on the data that he cherry-picked, he convinced the government. Government standards actually began recommending taking meat out, saturated fats out, and to a degree, that makes some sense. Overdoing it on anything is a problem. But what was it replaced with? Look at the food pyramid. It's replaced with 8 or more servings of grains a day. Well, we know that heart disease and cancer are more linked to grains, more linked to carbohydrates, more linked to the sugars we eat than they are to saturated fats. Now, what makes meats kind of a dangerous thing? Well, factory farming does. When you take animals and you put them on a food plot where there's not enough natural food sources, not enough water, and so the food has to be brought in, and it's grains, and there's fillers. Did you know some of the fillers that are put into the foods that these animals eat? Some of the fillers are ground up feathers, animal waste, insects, birds, polyethylene roughage replacement. That's plastic filler. Polyethylene roughage replacement, bacteria, PCBs, these are toxic chemicals, dioxin, and there's a lot of other additives, and these are not appetizing. They should not be in your food. They should not be in your body. You are what your food eats. So if you're getting meats that are factory farmed, not only is it cruel, not only is it harmful to the environment, it's harmful to your body. Now, the right meat, if you're getting the right meat, there's good scientific evidence that getting the right healthy meat, the right healthy saturated fats is actually beneficial to you. We actually know at this point in time, meat, obviously it's a great source of protein, a great source of essential amino acids. These are amino acids your body cannot make, and therefore you've got to get them from your diet. Well, when we look at people who get away from meat, vegetarian diets, they tend to have to really be careful in order to gain all these essential amino acids. And so this is such a big problem that if we have a patient in our care and there's a health condition, we want to make sure that they're actually getting some meat. We tend to reject cases where we can at least get a little bit for the benefits that it provides. In any event, the heart disease risks are more linked to It's complex, not just saturated fat, it's carbohydrate intake, it's blood sugar imbalances, it's triglycerides, there's stress concerns, and many more that affect heart disease. And so you can't just pin it on fats. Again, with saturated fat, there's something called good cholesterol, HDL. We know that actually improves the health of your arteries and improves the brain. Again, doctors are prescribing fish oil, which is a saturated fat, in order to help people reverse heart disease, to protect the brain, to help the hormones. So again, carbohydrates are your biggest culprit when it comes to heart disease. Now, should we go hog wild with eating meats and saturated fats? Not at all. We tend to want to look at meat as a condiment, meaning it would be more wise for you to have vegetables, a plant-based diet as your main, and then eat meat as a condiment. One thing you want to make sure that you do is don't mix saturated fats like what you see in meat with sugars, carbohydrates, processed sugars. That's a deadly combination. So again, we talked about we are what our animals eat, and likewise, if our animals are fed the way that they were made to eat, which is they're made to let to roam, they're eating grasses, they're consuming water, they're away from GMOs, they're away from pesticides, they're away from grains, they're away from steroids, hormones, antibiotics, then the kind of fat that meat produces is high, rich in omega-3s, which are inflammation fighters. They protect the heart, they protect the brain, they help the gut, they promote proper hormone function. Also, grass-fed meats all have higher levels of critical nutrients like B vitamins, vitamin E, antioxidants like lutein, zeaxanthin, beta-carotene, superoxide dismutase, glutathione. These are big free radical fighters. Also linked to cancer killing. It also has potassium, phosphorus, zinc, and iron. Grass-fed meat also is rich in conjugated linoleic acid, which prevents plaque formation in your arteries, atherosclerosis. It helps to lower the risk of heart disease, type 2 diabetes, lowers triglycerides, helps with weight control, helps with metabolism. And when you get grass-fed, organically raised, pastured meat, your levels of CLA, conjugated linoleic acid, are 500% greater than what's found in any other kind of meat. And so where the meat comes from, how it's fed is critical. Now, how do you get the right meat? Well, first off, you want it pastured, you want it organic, there's approval stamps that you want to look for, like the Animal Welfare Approved Food Alliance certified meat. There's Global Animal Partnership, there's certified humane meats. What kind of grass-fed meat do you want? Bison, beef, goat, lamb, sheep? Again, if they're certified grass-fed, look for the grass-fed logo. Again, why? These animals are fed a diet that's in line with what their genetics are for. They're fed on grass, they're pastured. It's not small feedlots. They're not in harsh confinements. They strictly forbid pastured and organic meat, strictly forbids antibiotics, strictly forbids growth hormone. It's always U.S. origin, U.S. born, U.S. raised, and not foreign. To find these meats, ask at your local health food store, the butcher, like at your Sprouts or your Whole Foods. They're going to have it. But I like to actually source my own meat from local farmers. We have a farmer that's been a patient for almost 20 years where they raise the meat for us, and the health is amazing. We've had it tested. The quality is amazing. Our blood work shows amazing. For those of you who aren't so lucky, you live in more of an urban environment, you can go to Eat Wild. Eat Wild is a website that has a directory for pasture-raised farms in your zip code. Local Harvest is another one. It'll connect you with real food, local farmers. Butcher Box and then Walden Local Meat are some services that provide it. Limit your processed meats, obviously, meats that are factory farmed, but also meats like bacon, deli meats, sausages that are made with lots of preservatives, lots of additives. We want those kind of meats, bacon, sausages, things like that, to be a very, very small amount, only occasionally. But if you do have them, make sure additive-free, filler-free, preservative-free, gluten-free, high fructose corn syrup-free, MSG-free. Processed meats almost always contain nitrates. Now, when nitrates are grilled, they turn into nitrosamines, which are carcinogenic. So obviously we want to keep those down. Buy local when you're getting meats, buy uncured when you're getting meats. So again, the meats you want: grass-fed beef, grass-fed lamb, pasture-raised pork, bison, venison, elk. And again, the small amounts of high-quality, organic, nitrate-free bacon, sausage can be fine. What to avoid: conventionally raised dairy, conventionally raised beef, conventionally raised lamb and pork, deli ham and processed meats, hot dogs, conventional sausage, bacon, salami. And so the notes for this, the ones that I created last night, spent some time on for patients, they're going to be available in the newsletter. So if you like this video, go subscribe to the newsletter, get this sent to you. It's going to be very valuable. And we look forward to talking to you soon. Follow our newsletter, look for our posts online. And again, your health is your wealth. If there's areas of your health that need supporting, please feel free to reach out. We'll try to help in any way we can. Have a great day.